So tell us a little bit more about what the Health Minister had to say and how that message was received by nurses themselves.
A very good evening to you, Francis, and to the viewers. Well, yes, the Minister of Health, went into lengths about the importance of this day, commemorating those foot soldiers, those resilient soldiers in the front line who go out of their way to take care of those who are infected with COVID-19, but also said to them that, be brave, be stern, be resilient, and continue doing the good work that you have done. There's been several, mention of nurses being not provided with the correct PPEs. If you've been following the news, you would have seen in East London, KwaZulu-Natal, as well as also in, King Williamstown in the Eastern Cape. A lot of nurses came out saying that they're not provided with the right PPEs, they're not getting the right tools in order to take care of those patients and also prevent themselves from getting COVID-19. And, he made mention of the fact that those nurses who are not provided with the PPEs, they should not go out and work, but also said that government will be ensuring that they take it up with the private sector as well as the public sector, ensure that all those foot soldiers in the front line are adequately tooled up in order to be able to protect patients that come into the many hospitals who have contracted COVID-19, but also to protect themselves from this coronavirus. So went into lengths about the importance of this day, but also made sure that nurses also know that they not only are soldiers in the front line, making sure that the rest of us are, looked after when we do contract the virus, but also made it a point and stressed the fact that they too are human and they should also be protected.
Well, interestingly enough, he spoke about mental health, issues that may even come up later. This must be a time of great anxiety. Did the nurses get a chance to talk about that? I guess because of the very nature of COVID-19, this couldn't be a huge gathering in the first place.
That's very true. Well, if I can just take you back to the setting, it was actually supposed to be a, virtual Zoom conference that he was having with several of the MECs around the country, all 9 of them. And then he allowed only a small group of nursing staff from King Edward Hospital in KZN, as well as some of the media. And he went into lengths about the importance of, mental health, and saying that, and as much as we have nurses who are at the forefront, but they too are human. They could also develop mental health from time to time, and also that this is this is uncharted territory, Francis, and that not much is known about this virus. And those people in the front line, those workers, the health practitioners who are going out there daily, risking their lives, this is also a very could be a mental impact on them. So he stressed the fact that several of the nursing staff will also be aided with social workers to try and talk about the issues that they have, but also provided with a lot of support. And there he went in again, calling government, saying that government's going to ensure that both the public sector as well as the private sector have these means of communication with the nurses as well as the doctors, so that if they need an outlet, they will have an outlet that can be provided for them. So when he went into mental health, merely stressing that there are avenues should those medical practitioners need anyone to talk to, there are definitely people that are listening.
All right, thank you very much, Jayed-Leigh Paulse.